Dr. Benilsha, Faculty of Department of Anatomy. I have 2+ years of teaching experience involved in 3 ongoing research projects, also a lifetime member of Society of Clinical Anatomists. So today's topic is about the salivary glands in the submandibular region. So here are the learning objectives. At the end of the session, students should be able to describe the parts, borders, surfaces, relations and nerve supply of submandibular gland. They should also be able to describe the course, relations of submandibular duct. Also, they should be able to describe in detail about the submandibular ganglion, in detail about the position, relations and the nerve supply of sublingual salivary gland. I'll start with the introduction, the submandibular region. So, it is located between the base of a mandible and the hyoid bone. It includes both submental and the submandibular triangles. So, 2 pairs of submandibular and the sublingual salivary gland present in the submandibular region. Next is the submandibular gland. It is a mixed type of paired salivary gland present in the submandibular region. It is about the size of walnut and roughly J-shaped and weighs about 15 to 20 gram. It is located in the digastric triangle in the submandibular fossa of mandible. Parts of the submandibular gland. So the mylohyoid muscle divides the gland into 2 parts, superficial part and the deep part. The superficial part is large and it lies superficial to the mylohyoid muscle. The deep part is small and it lies deep to the mylohyoid muscle. So both the parts continues around the posterior border of mylohyoid. So we'll see each of these parts in detail. Next is the superficial part. The superficial part is large and fills the anterior part of the digastric triangle extending up to the mylohyoid line. It has 2 ends, one is anterior and the posterior end, 3 surfaces, that is inferior, lateral and the medial surfaces. Facial covering are the capsule. So the superficial part is partly enclosed between the 2 layers of investing layer of deep cervical fascia. The superficial layer, it covers the inferior surface of the gland. The deep layer, it covers the medial surface of the gland. Next is the relations of the superficial part of submandibular salivary gland. So I'll start with the inferior or the superficial surface. It is related to skin, superficial fascia with the platysma and the cervical branch of facial nerve, investing fascia, facial vein and the submandibular group of lymph nodes. Next is the lateral surface. It is related to submandibular fossa of mandible, medial pterygoid muscle and the facial artery. Next is the medial surface of the submandibular gland. It is divided into 3 parts. So first part is the anterior part. It is related to mylohyoid muscle, mylohyoid nerve and the vessels, submental branch of the facial artery. Next is the middle part of the medial surface of submandibular gland. It is related to hyoglossus muscle, styloglossus muscle, submandibular ganglion, lingual and the hypoglossal nerve. Next is the posterior part of the medial surface of submandibular gland. It is related to styloglossus muscle, stylohyoid ligament, glossopharyngeal nerve and wall of pharynx. Next is the deep part of the submandibular gland. It is small and lies on the hyoglossus muscle deep to the mylohyoid muscle. So posteriorly it is continuous with the superficial part around the posterior border of the mylohyoid muscle. So anteriorly the deep part extends up to the sublingual salivary gland. Next is the relations of the deep part of submandibular gland. So laterally it is related to mylohyoid muscle, medially related to hyoglossus muscle, superiorly to the lingual nerve and the submandibular ganglion, inferiorly to the hypoglossal nerve. Blood supply of the submandibular gland. So the gland is supplied by sublingual and the submental arteries and it is drained by the common facial and the lingual veins. Lymphatic drainage of the submandibular salivary gland. So the submandibular group of lymph nodes drains the submandibular gland and eventually it drains into the jugulodigastric group of lymph nodes. Next is the nerve supply of the submandibular salivary gland. It is supplied by the branches from the submandibular ganglion via the parasympathetic or the secretomotor fibers, sensory fibers from the lingual nerve and the vasomotor sympathetic fibers from the plexus and the facial artery. So the applied aspect here is the palpation of the submandibular salivary gland. It can be palpated bimanually by putting one finger within mouth and one outside. The stone in the submandibular duct can also be palpated manually within the mouth and can be seen if it is sufficiently large. So it may require the surgical removal. Next is the submandibular duct. It is otherwise called as the Wharton's duct. It is a thin walled tube and it is roughly about the size of 5 cm in length. If you see the course of a submandibular duct, it emerges at the anterior end of deep part of the submandibular gland, runs forward on the hyoglossus muscle between the lingual and the hypoglossal nerves. At the anterior border of the hyoglossus muscle, the duct is crossed by the lingual nerve and it opens on the floor of a mouth on the summit of a sublingual papillae at the side of frenulum of tongue. The applied aspect here is the calculea stone in the submandibular duct. The stone is more common in the submandibular duct than the parotid duct because of thick secretions of submandibular salivary gland. Also, the duct takes a tortuous course which hampers its smooth drainage into the floor of a mouth. Next is the submandibular ganglion. It is otherwise called as the parasympathetic or the Langley's ganglion. It serves as a relay station for the secretomotor fibers supplying the sublingual and the submandibular salivary gland. So if you see the topographic relation, it is connected with the lingual branch of mandibular division of trigeminal nerve. Next is the functional relation. Functionally, it is related to the facial nerve and it is roughly about the size of pinhead. Next is the location of the submandibular ganglion. It is located on the outer surface of hyoglossus muscle, suspended from the lingual nerve by two roots, and it lies deep to the mylohyoid muscle. So if you see the relations of a submandibular ganglion, superiorly it is related to lingual nerve, inferiorly related to the deep part of the submandibular gland, superficially to the mylohyoid muscle, and it is deeply related to the hyoglossus muscle. Next is the roots of the submandibular ganglion. First is the parasympathetic root. It is secretomotor in function. So the preganglionic fibers emerging out from the superior salivatory nucleus subsequently passes through the facial nerve, cauda tympani nerve, lingual nerve and relies in the submandibular ganglion. So from the ganglion, the postganglionic fibers arises and it supplies the submandibular and the sublingual salivary gland. Next is the sympathetic fibers. It is vasomotor in function. So the preganglionic sympathetic fibers arises from the lateral consils of T1 segment of spinal cord and it relies in the superior cervical ganglion. So from the superior cervical ganglion, the postganglionic fibers it emerges and form a plexus around the facial artery and eventually it passes through the submandibular ganglion and it supplies the submandibular and the sublingual salivary gland. Next is the sensory root. It carries sensation. So the sensory fibers from the lingual nerve passes through the submandibular ganglion without relaying. The branches of the submandibular ganglion, it is about 5 to 6 branches supply the submandibular gland. Other fibers join with the lingual nerve to supply the sublingual and the anterior lingual glands. Next is the sublingual salivary gland. It is the smallest of all the major salivary glands. It is, if you see the shape of the sublingual salivary gland, it is almond shape, weighs about 3 to 4 gram and it is located in the floor of mouth between the mucous membrane and the mylohyoid muscle. Next is the relations. So anteriorly it is related to symphysis mentis, posteriorly to the deep part of the submandibular gland, superiorly related to the mucous membrane of mouth, inferiorly to the mylohyoid muscle, medially to the genioglossus and laterally to the mandible. Next is the ducts of the sublingual salivary gland. So the gland possesses about 20 ducts. So most of these ducts open directly into the floor of mouth on the summit of sublingual fold. So ducts from the anterior part of the gland unites to form a sublingual duct of Bartholin which opens into the submandibular duct. So if you see the blood supply of the sublingual gland, it is supplied by sublingual and the submental arteries. Next is the lymphatic drainage. It drains into the submental and the submandibular group of lymph nodes. The innervation which is similar to the submandibular salivary gland. So next is the applied aspect. Here is the ranula. It is a soft bluish mucus retention cyst in the floor of mouth due to obstruction of the sublingual salivary gland. It looks like a belly of a frog, hence called as ranula. So we have reached the end of the session. Hope you find this video is useful. See you all in the next session. Thank you.